Okay, so we're going to examine this patient today. She's got complaints of upper respiratory problems, some congestion, maybe a sinus infection. Okay, so we're going to do an HEENT exam first, head, eyes, ears, nose, and throat. Okay, so I'm going to go ahead and put on some gloves. All right, so how long have you been having these symptoms?
For about 2 weeks.
Okay, all right. So we're going to go ahead and look in the throat first. All right, what you're going to do is stick your tongue out and say, ah. I'm going to look in the back of your throat. Say, ah. Okay, just looking at the tonsils to see they're a little bit red. You're also looking for a postnasal drip on the back of the throat. You want to know if it's like a clear color or if it's green or yellow, something like that. So I'll put this in the biohazard. Okay. I'm going to press on her sinuses here. That's her maxillary sinuses. Does that hurt?
Just a little bit.
A little bit? What about up here? Does that hurt?
Right there.
Okay, that's her frontal sinuses. Okay. I'm going to look in her ears. I'm going to look in this ear. Okay, looking at the eardrum. Do you have any pain when I push there?
Not really.
Okay, or when I pull up there?
Mm-mm.
Okay. I'll do the same thing on the other side. Look in the ear. You want to see if the ear canal is red or if the eardrum is red? Any pain there?
Mm-mm.
Okay.
No.
All right. I'm going to feel for any swollen lymph nodes under her neck. So just go along and see if you feel any small bumps anywhere there. Okay, and also down the side of the neck. Okay, these are all your cervical lymph nodes and your submandibular lymph nodes. If any of them are swollen or tender, that's a sign that she might have a sinus infection. Okay, she's also been coughing a little bit. So we're going to listen to her lungs. What you're going to do is you're going to slide around and put your feet up there. Okay. And every time I touch your back, I want you to take a deep breath with your mouth wide open. Let it out. Okay. Is your mouth open? Okay, and then we're going to listen to the front also. So you listen to the top part of each lung, the apex. Do the hair. And then on each side you also listen towards the bottom of the lungs. And then you listen to the heart. Okay, so we're listening for any rales or rhonchi, which could be signs that there's a lot of mucus or fluid on the lungs, or wheezing. Wheezing would be maybe she's got inflammation or asthma, something like that. Now, another test you can do for a sinus infection is called the head tilt maneuver. You're going to stand up. All right. You're going to put your chin to your chest. You're going to bend down and touch your toes, or go down as far as you can like this.
Right now?
Go ahead and do that. You just now keep your chin to your chest and keep it there for a minute. Now you're going to slowly come up. Come up real slow. And you go a little bit faster. Okay. And if you feel pressure across here when you do that, that's a good sign that you have a sinus infection also. Okay, so that's just a basic exam that the doctor does when they're having any type of ear problems, sore throat, coughing, runny nose, sinus problems, things like that. Thank you very much, ma'am.
Thank you, sir.
Right, pause it. I don't know how to pause it.
Stop it. Just